Vaccines are currently scarce in the state. Can you talk a little bit about what is the current availability and how do we ensure that those who need it most are getting the vaccine?
So I will do the best I can to explain this for everyone. So currently, the state of Nevada receives limited doses of the COVID-19 vaccine, and it's not just our state, this is nationwide. And that is really just based on the availability of vaccine in our nation. And so doses each week, the doses are allocated to our state and then down to the county level. And um, into our sites like on a weekly basis, depending on the allocation of what the federal government has given us that week. So really the availability really just depends on how much vaccine is available. And currently it is on the low side. So the availability of the vaccine is low due to the low allocation. If you need additional information about where you can get vaccinated in your county, I did want to put out that you can visit MV COVID Fighter. So that page contains a variety of resources, even on the county level, about where you can get vaccinated, who your county is currently vaccinating. And so please utilize that website as you can. It is updated regularly to reflect current information for all of you to have. And then to the question about ensuring those who need it most are getting it. To really ensure that those who need it the most are getting the vaccine, especially because the allocation is currently so low. Vaccination efforts really continue to focus on those who are critical to the COVID-19 pandemic response, those who are providing direct care, maintaining societal function, and then as well as those who are at high risk for developing severe illness from COVID-19. And then the other piece is really communication. And so that's really making sure that all of our communities in Nevada have the information about when it's time for you to get vaccinated, how you can get vaccinated, where you can get vaccinated. And it's really, really meeting everyone where they are with information. And so we have really been working with our community partners to help disseminate information for everyone so that the information is out there. And then also really working to really understand where our different communities are with information. So where all of our diverse communities are, what the myths are out there, what misinformation is being circulated around, and really addressing it as we can. And again, really, really in partnership with our community partners, with our state leaders, in order to get this information disseminated for you all. So it's really to ensure everyone's getting it. It's really, I think the communication piece is big, because if there are myths and all the myths and misinformation there, then that definitely dissuades people from wanting to get the vaccine. And so people aren't getting vaccinated that way. And then also just making sure that information is easily accessible and readily available, so folks know where they can get vaccinated, when they can get vaccinated, and how they can get vaccinated.